Hi, my name is Carlie Arbaugh, and I'm a general surgery resident here at Stanford. I'll be presenting a study that I've been working on with the support of Dr. Cynthia Kimura and Dr. Cindy Kin, entitled Multidisciplinary Gastrointestinal Healthcare Professional Beliefs, Behaviors, and Practices Around Personal and Patient Nutrition. Nutrition plays a role in disease prevention and treatment, but unfortunately is minimally addressed in most healthcare professional education systems, such as medical schools. We know from studies that personal health beliefs and habits of healthcare professionals influence how we counsel our patients. So the aim of this study was to explore nutrition beliefs and practices among healthcare professionals, specifically caring for patients with surgical gastrointestinal issues. We administered a survey to gastrointestinal surgeons, including surgical oncologists, colorectal surgeons, and HPV surgeons, medical oncologists, gastroenterologists, advanced practice providers, and dietitians on their nutrition beliefs and patient care practices around nutrition in the perioperative time period. We then conducted semi-structured interviews that were recorded, transcribed, and iteratively coded, with thematic analysis also performed. Of the 38 healthcare professionals that we invited to complete the survey, 26% completed it, and 15 of those were interviewed until thematic saturation was reached. Demographics of the survey participants included a well-distributed age range from 20s to 60s, self-described gender that was also split in terms of 54% female and 46% male. And then in terms of healthcare specialty, about 54% were from surgery, 23% from medical oncology, and 12% each from gastroenterology and dietetics. Moving to table 1, this outlines some of the questions that we asked healthcare professionals in their nutrition survey. Popular diets that healthcare professionals follow themselves include vegetarian diet and Mediterranean diet, which were 19% and 15% respectively. Other diets that were followed include plant-based, pescatarian, low-fat, intermittent fasting, low-carbohydrate, and high-protein diets. Dietary principles that were popular among healthcare professionals personally include eating fresh foods, maximizing home-cooked foods, avoiding simple carbohydrates, eating whole foods, and everything in moderation. And the percentage of healthcare professionals that were reporting that they believe in these principles was 60% or higher. To what extent do healthcare professionals think that patient nutrition impacts their surgical outcomes? About 62% believe to a great extent, and another 39% somewhat. There was nobody who felt that it did not at all play a role in surgical outcomes, or that it played a very little role in surgical outcomes. How often are healthcare professionals counseling patients about nutrition? About 27% said always, and another 50% said often, and then the last 23% said sometimes. When is this counseling about nutrition occurring? For 85%, it's occurring in the outpatient setting during clinic visits, and the other 15% while the patient's admitted to the hospital. How equipped do our healthcare professionals feel in answering patient questions about nutrition? About 15% reported extremely equipped, another 27% very, and then 39% moderately. How often are healthcare professionals prescribing or recommending nutritional supplements? About 80% are sometimes, often, or always prescribing nutritional supplements. And then what is the willingness of healthcare professionals to recommend or prescribe a more natural alternative to a nutritional supplement, such as a protein-enriched smoothie or soup? 89% of healthcare professionals said yes, absolutely, they'd love to try that. And another 7 to 8% said maybe they would be willing to give that a try. So overall, about 97% were on board with that concept. Shifting to table 2, this outlines just a couple of many themes that we found in the interviews. These were themes specific to patient nutrition care. So in the first box, healthcare professional beliefs, experience, and practices around patient nutrition, we saw that patient situation and care setting greatly influences the approach. So, for example, there can be competing demands between acute and chronic health conditions and between prevention and treatment. There are many dietary trends and fads that we're all aware of in popular culture, and that adds to patient nutrition complexity in counseling. As was seen in the survey, nutritional supplements are often used, but it was pointed out that these are an imperfect patient tool. Healthcare professionals have widely differing strategies in terms of how they counsel and coach their patients. But in general, many agree that they like to liberalize what their patients eat rather than restrict. And that is true, especially of cancer patients and post-op patients once they're tolerating a diet. Healthcare professionals have a lot of ideas about what barriers and facilitators may be influencing patient nutrition. They also have professional lifestyle beliefs and specific prescriptions that they give to patients, such as dietary recommendations, physical activity, specific fiber amounts, and very frequently, small frequent meals are recommended or exercise regimens for cancer patients. And then there's a pretty large spectrum of referral practices in terms of who feels comfortable referring their patients to a dietitian and who does not. Along those lines, we also saw many gaps, inconsistencies, and barriers in nutrition knowledge and practice. There were some systemic issues that resulted in delays or prevention of patient nutrition care, such as insurance approval challenges, understaffing among dietitians, and a lack of continuity. We also saw a lack of information or misinformation about many nutritional concepts. So either the study not existing or the healthcare provider not being aware of the study or being misinformed. There were some signs of care team disconnect as well in terms of approach to patient nutrition care. This was often seen when it came to postoperative low fiber debate or how quickly the patient can or cannot advance their diet postoperatively, as well as disagreement about what patients actually want to know in terms of their nutrition. And so based on all of this information we collected with the mixed method study, we were inspired to form a multidisciplinary task force, which includes several surgeons, several dietitians, a number of folks from the healthcare food services leadership, and a culinary consultant. And all of these people are very committed to improving the nutrition experience of surgical patients. One of the biggest projects that we've been working on so far with this task force is designing and piloting high protein, whole food, plant-based alternatives to nutritional supplements, such as protein augmented smoothies and soups. So more to come. Thank you so much.